Prominent cancer drug crusader Malcolm Mulholland has revealed to Newshub he has himself been diagnosed with cancer.
His journey through the health system has found deficiencies in cancer care, and now his fight for better health care is even more personal. Political editor Jenna Lynch has the story.
Malcolm Mulholland has spent his adult life fighting for better health care. Now Malcolm is having to fight for himself. Just 9 months after losing his beloved wife Vicky to breast cancer, the big C has found him.
To have to go home and tell the children, you know, we're facing cancer again, that was a bloody tough conversation.
The 46-year-old diagnosed with an aggressive prostate cancer in July.
My number one thought that went through my head when I was diagnosed was, given that we just lost Vicky, that I didn't want my children to become orphans.
He's lucky it was picked up early. He spent $40,000 on private robot-assisted surgery, and his future is looking much more positive than he thought. In December, he'll find out if he's cancer-free, but things very easily could have turned out differently.
Well, my cancer was picked up purely by chance. I had no symptoms whatsoever that something was wrong.
If it were not for an underlying condition, they probably wouldn't have found it. He may not have the shot he has today. The Ministry of Health screening guidelines date back to 2015 and were supposed to be updated in 2018. Under ministry guidelines, management only begins if men present with prostate-related problems, so if they're symptomatic. Best practice advocacy suggests men over 50 should be offered testing even if they're asymptomatic.
The reason for the Cancer Control Agency is we get one common set of guidelines that the medical fraternity all understands and knows and applies. That's where we need to get to.
The Prostate Cancer Foundation says men are slipping through the cracks.
Men that have been diagnosed with prostate cancer in New Zealand don't have access to the medications they should that would prolong their quality of life and also prolong their life.
The Cancer Control Agency told Newshub it's currently reviewing ministry screening guidelines but didn't give a timeline for that work. And once again, the problem circles back around to medicines funding, something that is desperately needed and something that Malcolm Mulholland has said too many times for too many people. Jenna Lynch, Newshub.